Good afternoon, Elder Justice Warriors. I am so pleased to have you here with us today, commemorating World Elder Abuse and Awareness Month for us here in California. And I just want to start out by saying that Ombudsman Services of Contra Costa, Solano, and Alameda is so pleased to be wrapping up the inaugural year of the Elder Justice Lunch and Learn webinar series and commemorate June as World Elder Abuse Prevention Awareness Month. But we appreciate the support from the community of professional advocates like you who fight for the rights of older adults and those with disabilities to live free from abuse and neglect, and have made this series a success. This important training opportunity would not be possible without the support of Kaiser Permanente, California Department of Social Services, California Department of Aging, California Commission on Aging, California Long-Term Care Ombudsman Association, California Association of PAPGPC, and California Elder Justice Coalition. We look forward to continue this conversation with the Elder Justice Lunch Learn community and encourage everyone to register for future webinars. Now, as you know, we like to make this an interactive session, so I encourage those of you who are popping in to drop your name and what you do, and maybe where you're located in the chat so we can get a sense of what kind of work you're doing and you can connect with your colleagues. I also want to remind everyone that you are the people that dictate our questions and comments. So as things start to come up for you through Paul's session, please drop your comments in the chat or the Q&A. Also remember that we have closed captioning enabled, and you can select that on your toolbar. And we also have ASL interpretation provided by California Department of Social Services. So as a reminder, we are here every Thursday, or the third Thursday of every month, but we are taking a summer break next month, and we hope you will do the same. So you won't see us in July. If you are just really jonesing for your elder justice fix, you can go ahead and go to our website at ccombudsman.org, and you can watch any of the past sessions that we have done over the last year. But I hope to see you back here in August, refreshed and ready to jump back into this topic area. As I said before, our work would not be possible without our sponsors, and I want to thank them for their support. And lastly, we are here today with our dear friend, Paul Greenwood, who has been our guiding light and our sensei through this whole process. He is back with us to close out the year to talk about how we can bring elder abuse out of the shadows and how we as a community need to bring light to this issue. So Paul, I want to thank you for being such a pillar of this inaugural series, and I want to turn the floor over to you.
Well, thank you so much, Nicole, and thank you all of you for joining. It really has been a spectacular series, and one of the benefits, I suppose, of having gone through the pandemic is we've all grown to appreciate and utilize the advances in technology to be able to speak to over 208 people, some of whom are not even in California. We have over 30 states represented. We have people from Canada and Northern Ireland and Malaysia. So this is really truly remarkable. And thank you to the team that has put these Elder Justice Lunch and Learns together. So I just want to spend a few minutes sharing the lessons that I've learned about the tools that hopefully we can all use to bring this crime out of the shadows and into the spotlight. And it's very appropriate that we are holding this event this week on Tuesday, we celebrated World Elder Abuse Awareness Day. And this was first started in 2006 with the International Network for the Prevention of Elder Abuse, along with the World Health Organization. And since 2011, the United Nations has made it an official day in the calendar. So more and more countries have got involved, more and more jurisdictions have been holding events, and we've made purple the color. So I dug out my one purple tie today in honor of World Elder Abuse Awareness Day. A little bit more just briefly about my background. As you can probably tell, I'm not exactly your classic Southern California dude. I was a lawyer in England for 13 years. I tried the barrister, but I did not look good in a white wig and a black gown, so I quit and became a solicitor, a general practitioner. So how on earth did I end up in California? True love. I was able to meet my wife as I was traveling literally around the United States back in August of 1973. And I literally walked into a Baptist church and the only empty seat was sitting next to this gorgeous young lady. And I did. I sat down next to her. And yes, I married her, but not in the same service 5 years later. We were there in England for 13 years. And then in 1991, because of some health issues that my wife had been experiencing, we decided to make the transition with a 10-year-old daughter and a 4-year-old son back to San Diego. It was a very challenging time for me. I was jobless, unqualified. So what did I have to do? I had to sit for the dreaded California bar exam, along with 1,000 other people in a large room in the convention center in San Diego. Thankfully, I was able to convince the bar examiners that I knew more than I really did, and they gave me a pass. So I joined a civil law firm for 2 years, but frankly, did not really enjoy it because my heart has only and always been in the criminal courtroom arena. I think that's largely because when I was about 6, my parents allowed me to stay up on a Saturday night, watch on my black and white television, Perry Mason. Then in 1993, my big break came. The San Diego District Attorney's Office took a risk and they hired me. I was their first ever green card resident alien prosecutor. Fortunately, since then, I've managed to become a very proud citizen of this incredible country. But at the time, they took a risk, and I'm so glad they did. So for 25 years, I worked in this very innovative environment. And the San Diego District Attorney's Office has a reputation for trying new things. One of them was this court support program for vulnerable victims. And it all started with a vision of an injured police officer bringing her service dog into our office and asking us, have you ever thought about using such an animal in the courtroom? And you never find out unless you try. And we did try. We overcame defense attorneys' objections, and it's been a remarkable success. And my hope is that this program will be replicated through every single prosecutor's office in the United States. Every day I would walk into this building on Broadway in San Diego, and it was actually called the Hall of Justice. And it's no exaggeration to say that probably almost every single day, I would look at that and remind myself where I was going. I was walking into an arena that called for justice. And in fact, above one of the elevators, before I would go up to my office, there was an inscription which said, an injustice anywhere is a threat to justice everywhere. And I loved that reminder because sometimes as a prosecutor, justice required me to dismiss a case. And I felt good about that from time to time. So how did it all start? With a journey pursuing justice for older victims and dependent adult victims. Well, it started with a call from my boss in late 1995. And I remember it well, and I could tell he was a little upset. And I asked him why, and he said, I've just had a very upsetting phone call from Adult Protective Services. I said, who are they? He says, I do not know. but I know the one thing, they're upset with us. Why? I asked. Apparently, he said, we are ignoring a huge escalating crime called elder abuse. I then said, what is that? He said, I don't know, but you're about to find out because I've just named you as the first head of the first ever Elder Abuse Prosecution Unit. And that was my start. This became my assignment for the next 22 years. It is very unusual for any prosecutor in the United States to spend 22 years prosecuting only one specific type of crime. And I've often been asked that question, why? And it's a very easy response. Primarily these two reasons. And here they are. This is a picture of my late parents. And sadly, I lost my father back in December of 2014 to advanced Alzheimer's. Some of you on this webinar have gone through or are going through similar experiences that I went through as a son, watching my father slip into further serious progression of Alzheimer's. It was a very hard experience for all of us, particularly my mother, who I lost in November of 2019 at age 96. But I don't think of my father as an Alzheimer's victim primarily. I think of him as a true hero, just like everyone in his generation from World War II. My dad, I discovered when I was 7, had been a bomber pilot in World War II, had survived 98 bombing missions. And on 97 of them had landed perfectly. But on mission number 6, on June 4th, 1944, my dad's aircraft was attacked by enemy aircraft, and he ended up 50 feet below the surface of the Adriatic Sea. With his final breath, my father tugged at the cockpit fuselage and managed to dislodge it and floated to the surface, where thankfully he was rescued by Yugoslav fishermen. And then there's my mum. My mum, who I know is the finest baker of scones in the whole wide world. I miss them both a lot. And I do happen to believe that they are representative of our finest generation. That's why this became my career for 22 years. And sadly, we only have just over 300,000 of these men and women left from World War II, and we need to cherish them. So back in 1996, they gave me everything that a prosecutor needs, right? Except one thing. The one major thing that was lacking, no cases. I literally was wondering and asking, why isn't any law enforcement officer bringing me a case of elder abuse? All I had to combat was silence. And this is very uncommon and it's unfamiliar to prosecutors because typically you are never without a case. And so I had to start my own journey of discovery. And I soon discovered the reasons why. And in fact, Alberta in Canada has said it well. They said elder abuse thrives on silence. I spent basically the next 22 years looking for ways to take this escalating crime out of the shadows and into the spotlight, looking for tools that would help me do that. Because absolutely, it's as important today in 2021 as it was back in 1996 to find creative ways to make sure that elder abuse is very much in the spotlight. So one thing that I realized I needed to do, and to do it again now, is to raise the public awareness out in the community. I discovered that there were two main prongs to do that. First of all, because bearing in mind I had had this brief conversation with my boss when I said to him, "Who is Adult Protective Services?" I had never heard of them before. I had heard always about Child Protective Services, but I had not heard of APS. I did not know where they were or what they did, and I certainly could not find a phone number for them. So I went to APS, and with their cooperation, and then I went out and looked for an advertising agency. We came up with a campaign called Silent Isn't Golden. And thanks to this advertising agency, they came up with the idea of color coding. We used red for physical abuse. We used green for financial exploitation. And we used blue for neglect. And we got this advertising agency to do this campaign free of charge. I can honestly tell you that today there will be advertising agencies in your jurisdiction or nearby that would be willing to donate their time and money to a pro bono public service campaign such as this. But you will never find out if you don't ask. Secondly, by conducting educational outreach all over our county. Excuse me. I know that people say that public speaking is one of the biggest fears that people have. But you can do this, because if you get an opportunity, please take it. From Rotary, where the average age of the Rotarian is probably in their 40s. And why is it important for them? Because they have aging parents. Kiwanis, what is their average age? Now I'm going just from my own experience in San Diego here, average age, early 60s. People starting out, possibly thinking about retiring. Perfect message for them. Lions Club, my experience was the average age was about 84. Again, perfect audience. And everybody wants just 20 minutes of your time to really hit hard on what you are seeing, what you are hearing, and how you can involve these organizations in helping. Retiree organizations constantly were asking for presentations and then moving around to various adult day centers over the lunch hour and speaking to seniors and their caregivers was a wonderful way to get the message out there. You can do this. It's up to us to get that message out into the community to raise the awareness level. And then, of course, I turned my attention to law enforcement. These were the folks that I respected, that I admired, that I had worked with for the previous 3 years, but suddenly they were absent. They weren't bringing me any cases. And for me, there was an obvious opportunity here to go to the chief. My mother had taught me long ago that if an opportunity presents itself, do not squander it. And within a few months, the police chief actually contacted me and said, I'd like you to make a presentation to my upper management. And so I did. But I seized the opportunity by publicly in front of his management, challenging the chief and saying, Chief, if you're serious about this, you need to create a unit of detectives assigned to investigating elder and dependent adult abuse. To his credit, Chief David Bejarano in San Diego exactly did that. And for the last, well, gosh, at least 18, 19 years, we have had a dedicated unit staffed by at least 4 detectives and a sergeant doing nothing but these investigations. And what would happen is that the first responding officers out there in the community would take the initial report, but then turn the case over to that dedicated unit. The result being fewer cases were being ignored, written off as civil, or just closed prematurely. And there was also less opportunity for what I call misconceptions to act as a barrier to investigations. And those of you who've been part of any training that I've conducted will probably remember that I spend a lot of time talking about and tackling misconceptions, such as it's just a civil matter, or victim declines prosecution, or victim is 90 years of age, therefore victim will be ineffective as a witness in the courtroom. These are myths. And my privilege of conducting over 750 cases, felony cases in the courtroom, have proved to me that they are indeed misconceptions. This is my wish in 2021, that every single peace officer in California and across the country should receive mandatory training in what is called EAGLE. Some of you know about EAGLE. It stands for Elder Abuse Guide for Law Enforcement. It is a phenomenal project. It is on the web. You can download it. Just type in Elder Abuse Guide for Law Enforcement, and you will come up with this cover page. And it has all kinds of help and guidelines for police officers, for deputy sheriffs, checklists, how to conduct interviews, how to do proper photographing of evidence. And in California, it has a drop-down menu for every state. And in California, here we have California Penal Code 368, and it will give you all the elements of the crime and what you need to look for. If you would like to join me in trying to make sure this happens, let's talk about it in the future, because this, to me, is one tool that we cannot afford to ignore. And if we can get all law enforcement using this tool, and it's going to be an app which they can then download onto their smartphones and onto their iPads, this will be such a help to them as they are out in the field. And then turning to EMTs and paramedics, my experience, and I base this not just from the San Diego District Attorney's Office, but from talking to other folks in other jurisdictions, both in California and across the country. It is my belief that they are the most underused witness in an elder or dependent adult abuse trial. And I've never understood that, because for me, often the paramedic was the most effective witness. And I could always gauge that by the body language of the jurors. And I learned early on that paramedics hear and see things that no one else observes. And often they do walk into a crime scene, and unless they are trained, they will ignore vital signs. It is so important that we train the paramedics into the red flags of what to look for, and then to call law enforcement as they are treating the victim. And then additionally, in court, I can tell you, they make phenomenal witnesses. Why do I say that? It's not scientific, but I happen to believe most paramedics in California, at least in San Diego, were male. And I do believe that when God creates a male paramedic, he never creates an ugly one. They all look either like Denzel Washington or George Clooney. It's true. And when you have Denzel Washington walking into my courtroom in a dark blue uniform, and I've got 7 female jurors sitting in the jury box, it is over for the defendant. Especially when I ask Denzel, sir, what is your job description? Well, actually, it's to save lives. It is to run into burning buildings and sometimes to climb up trees to rescue cats. I mean, these are our superheroes. And anything that Denzel will say will be written down by the juror. I've seen it time and time again, and they will absolutely believe what Denzel is telling them. But unfortunately, not every police officer questions Denzel. Not every prosecutor asks for Denzel to be questioned. But I really hope that we can do that in future because they are such an important part of the equation. The training that I have given to paramedics includes a checklist, asking them, did you listen to the 911 tape? What's the demeanor of the caller like? Was it the victim? Or was it potentially a suspect? Was there any delay in calling for 911? Was there evidence that the body may have been moved? Any indication of drug or alcohol use in the environment around you? I also found that the victim was often willing to talk to Denzel or George Clooney in the ambulance away from the suspect. And those were dynamite statements often that we could use in the courtroom. Even if the victim had since passed away, we might be able to get them in as an exception to the hearsay rule because they were called, quote, spontaneous statements, or were statements that were being offered as part of the medical history. And along the similar lines, training the dispatchers became a wonderful tool. So twice a year, and I still do this, I would train the recruits in the Sheriff's Academy who had just been hired to become 911 operators. What questions to ask on that call, how to respond to an elderly person who may be suffering trauma or shock and who may be hard of hearing. Deal with them with patience and with reassurance. Or if the call is coming in from a suspect, then make sure you ask some very pointed questions, which we now can lock in and use against the suspect, potentially at trial. I then found another tool. We needed to reach out to every single ER, urgent care, clinic, hospital, and talk to the triage nurses, talk to the primary care physicians on call, talk to the discharge planners, remind each of them that they are all mandated reporters, to then have a discussion about the difference between accidental and non-accidental injuries. How do trained medical personnel identify when somebody is presenting with suspicious injuries, even though the patient may be saying, oh, I bumped into some furniture? By having those kinds of injuries differentiated, and then the suspicion is raised, and then reports are being made immediately to adult protective services and law enforcement. And then I turn my attention to the medical examiner, or sometimes called the coroner. And I realize that we were sometimes missing suspicious deaths. And I do wonder, how many times has a person died and we have failed to understand that their death was in fact non-accidental? So to look at what the protocol is for when the medical examiner will take a body for an autopsy, what requirements does your office have for waiving jurisdiction? We developed a protocol so that whenever a police officer or a paramedic called in a death of an older adult to the medical examiner's office before the coroner would waive jurisdiction, that the coroner would check with Adult Protective Services to see if the name of the decedent was on their radar screen in the last 5 years. Unfortunately, as ProPublica did in an excellent series of articles, suspicious elder deaths are rarely investigated. There is a tendency to assume that because somebody is 85, therefore they have always died from natural causes. But by just looking at 2 examples, and on the left is the United Kingdom's most notorious serial killer. And he was a medical doctor, Dr. Harold Shipman. It is believed that he murdered in excess of 350 of his elderly patients. 350. And he did it by conducting home visits and by injecting them with lethal amounts of morphine. And why? He was adding his name on a separate legal document called a codicil or a will as a beneficiary, so that after they died, he would actually inherit some of their estate. And you would say, how could that happen? It happened over a period of 18 years. And then on the right, you have Charles Cullen, who was a registered nurse in Philadelphia and New Jersey, and who on particularly night shifts would concoct a lethal dose of different types of injections and kill patients. And he admitted to at least 28 murders. So those are 2 extreme examples, but it's just to point out that these things unfortunately and tragically occur. And then I turned my attention to the financial institutions. Now, it didn't happen straight away, but after several years of going to Sacramento, I was part of a team of people that was finally able to convince the legislature to expand the definition of mandated reporters to include every single employee of a financial institution. And to me, this is where we need to really spend a lot of time. We have got to roll out some kind of program where every single teller in California is encouraged to become more proactive. And what I mean by that is have the tellers, first of all, educated about the current types of scams, to have tellers look out for any unusual activity of their customer or member. And I just want to give you an example of what I'm talking about. Across the street from where I'm speaking to you lives my 89-year-old neighbor, a widow. We've known her for over 14 years. She knows what I've done. She knows what I do. She knows, in fact, she has been to 1 or 2 of my trainings. A few months ago, she called me and I could tell she was shaking and upset. And she said, Paul, I'm about to head out to go to a couple of supermarkets to purchase $23,000 worth of gift cards. But something inside me told me to stop and call you before I did. I went over to the house, sat with her, and I said, do you still have your money? Yes, she said, I withdrew that money this morning from the bank. She presented it to me. We got in the car, I drove her back to the bank, and I spent the next hour and a half inside that bank. We redeposited her money, but I spent the time trying to educate and asking the bank, what on earth were you thinking by giving my 89-year-old neighbor $23,000 in cash in broad daylight? when she's never, ever withdrawn more than $100 in her life from your branch because they had failed to ask appropriate questions. You know, elder financial exploitation is now being called a public health concern by the US Centers for Disease Control with good reason. And many of us have met victims of elder exploitation, and we have observed how their health has been impacted. And if you believe the headlines, you know that we're in for even more cases like this. Just yesterday, the FBI issued their latest report on elder fraud and has shown statistically how the cases, particularly involving victims over the age of 60, are escalating at an alarming rate. One of the things we can all do is encourage every single bank and credit union in California to adopt a pilot program from AARP called Bank Safe. It's phenomenal. And if more banks did this, I can guarantee you, I think, that we would have less instances of where elders have actually lost their money. I also want to briefly tell you about a story I heard yesterday from a little town of 29,000 people called Oak Ridge in Tennessee. A former LA cop retired to that town in Tennessee, and she was concerned about elder financial exploitation. She joined the local Oak Ridge Police Department, was given a work-related cell phone. She went to every bank in that town and said, "This is my cell phone number. Call me if you suspect that any of your customers are about to be ripped off in a scam or some other type of theft." And so she became at their disposal. And you know how much money she has helped save from being lost? $3.5 million. Also, we need to be more media friendly. We've got to involve them, allow them to interview us, submit articles for print. They are always looking for a compelling story. This is one of the best articles I've ever read, How the Elderly Lose Their Rights. And I'm so glad that I saw pop up on the screen that one of your attendees is from the probate court investigators in Sacramento, because every single probate court investigator in this country should read this article, because it is shattering and it's scary and it's potentially happening in our jurisdictions. Conservatorship abuse. We've got to involve the Contractor State License Board, who do such phenomenal work. They also, in my cases, provided an expert contractor witness at no expense to my office. And they operate statewide. So often the perpetrator, a bogus contractor, would move from county to county, and we could follow them and share information with different counties and enable us to prosecute sometimes multiple defendants. They have always done such a great job. This is one of the cases they helped me with. They investigated a bogus contractor who called himself Father and Daughters Christian Construction Company. So you know where he put this flyer, don't you? In a big church parking lot. And then one of the last cases I prosecuted involved a garage door company that tricked people into believing that it was a local company. They would put at the beginning of GDS a local name, Escondido Garage Door Services, for example. And yet it was based out of Dallas, Texas, and they would train their technicians to oversell and upcharge ridiculous amounts of money. In a couple of my cases, the victim, over 80, would be charged up to $4,000 for a simple repair. But thanks to CSLB, we got this technician off the streets. And then getting local supermarkets involved in training with identifying red flags when people come in and purchase excessive amounts of gift cards or want to do a wire transfer. And then there's the added thing of, in supermarkets particularly, criminals acting in tandem, stealing purses or wallets from shopping carts or from the car as the elderly customer is loading groceries into the trunk of the car. I was pleased to see that in North Carolina, the Attorney General there is pushing for mandatory scam awareness training for retailers who sell gift cards. We need to do something like that here in California. And now, unfortunately, the crooks are now turning to Bitcoins. And if you've never seen a Bitcoin ATM machine, that's what they look like. And so we need to, again, educate the operators of these Bitcoin machines and have them put a large sign up warning people to be very careful about using this machine. What about long-term care? Well, I think one of the tools we were able to use was coordinating, particularly with community care licensing of the Department of Social Services, to involve assisted living facility and skilled nursing facility administrators. Why are they so critical? Because often the hidden crime is occurring in one of these facilities. And during the pandemic, when there's been such enforced isolation, this is the perfect opportunity for a predator to go to work. CNN revealed the series of articles. It's not pleasant reading, but it's the truth. We started what we called our ALF project, our assisted living facility project, in which community care licensing sent every single day reports that they had just received of any allegation of abuse or neglect directly to my office and to the Attorney General's office. They have a wonderful website. We've got to encourage people to go to that website, and if they have a concern about a facility, to type it in. If the facility is a skilled nursing facility, the state agency responsible for issuing licenses is the Department of Public Health. Again, they have an excellent website, but I'm also encouraging and urging the Department of Public Health to become more transparent, like community care licensing, and to have them share immediately information with local law enforcement and with the prosecutor's office anytime they get in a complaint or an allegation. Because so often, by the time DPH issues a citation, the evidence may not be there. Don't forget to also use the tool, which I have used many times, reaching out to the Attorney General's office. They have a fantastic unit called Medical Fraud and Elder Abuse. They have a great website. They have a complaint form. So even if local law enforcement is not able to assist with the investigation, make sure you reach out to this excellent unit in the California Attorney General's office. Also, it's important to let your local politicians know what you are doing, what is happening in your communities. Why? Because they hold the purse strings for the resources. And that's what we did in San Diego County. We asked for public hearings so we could bring in victims to tell their story. And please don't be afraid to ask for more resources. You know, one of the things I can still not figure out is why adult protective services in any county is not as efficiently budgeted for as child protective services. It just makes sense to me that we should have commensurate financing for APS as we do for child protective services. We need to involve all of us in the community. You know, we're all part of the team. We started what is called an Elder Protection Council in our county, and we invited people from all branches of government, from the retirement community, from the older community to join in with us. Because one thing I've learned, it takes all of us to keep our older adults safe. I like this quote: alone we can only do so much. But when we start embracing the ideas of a teamwork approach, it's amazing. And I love this image from Hawaii. Those of you who've been to Hawaii, probably you have seen folks in an outrigger canoe. And I've always been so amazed by the synchronization as they paddle in time together and as they whip through the waves. It's amazing the progress that you can make when you are coordinated, working as seamlessly as a team. So really, why and what is the conclusion for trying to get all these resources, of trying to work with all these tools? Because we don't want any victims to slip under the radar. I know this is a lofty goal, but it's something that we need to aspire to. My mother used to say to me, set the bar high, because you need something to work towards. We need to make sure that this crime is firmly put into the spotlight, so that once we adapt and use and adopt some of the tools that I've recommended, I believe that we can help this insidious, escalating crime emerge from the shadows and place firmly into the spotlight where it belongs. So reaching every victim is our goal. And I'm just going to leave you, before I hand it back to Nicole, with my email. It's paul@greenwoodlaw.com. I finally got a website now, greenwoodlaw.com. And if you would like me involved in any way to help expand or start an initiative in your area, for example, if you'd like all your law enforcement in your jurisdiction to be educated about Eagle or bank tellers, I would be delighted, especially as we open ourselves up to more in-person training. I would be absolutely privileged and honored to join you in your jurisdiction and help start a movement, which I think will only get better and stronger as time goes by. So with that, I'm going to stop my share and hand it back to Nicole.
Thank you so much, Paul. We appreciate you bringing those issues to light. And so I want to remind everyone that we have some time for some questions. So please go ahead and drop those in either the chat or the Q&A. And I want to start with you're sort of talking about those first responders, the folks who are working EMS or fire, because they are so often, I find, in long-term care buildings quite frequently, and we don't realize that. I would maybe also add to that transportation companies, because they often transport folks to dialysis or a doctor or back to the hospital. And so can you talk more about those good folks and what kind of training that we could offer to them to really listen to that spidey sense, that feeling when they feel something isn't quite right? What kind of information could we be empowering them with that would help to prevent and end abuse?
Well, that's a great question. I think paramedics are pretty intuitive anyway. And I always tell them, look, even though you're treating one particular resident in a facility, look at the faces of the other residents. See how they are reacting. Are some of them just sitting in a corner, not reacting to anything? What is the level of staffing that you're going in? Because remember, these paramedics are going in sometimes at 3 o'clock in the morning. You know, what level of staffing have you seen? How did it smell? How did it look? And then with the transportation companies, just be engage in conversation with the resident or with the relatives of the resident, and pick up on anything that they say which suggests that things were not right back in that facility. I had many conversations with paramedics when I reached out to them for training, when they would give me a list of the frequent flyers in our community where they would always end up. Sometimes it was an unregistered assisted living facility that was really operating under the shadows and shouldn't even have been in operation, or it was an assisted living where they've had so much trouble. So this is information that we've got to encourage EMTs and transportation companies not to keep to themselves, but to make sure that it's passed along to law enforcement and prosecutors.
Okay. I also would maybe offer what I have found is that law enforcement and oftentimes first responders, they have stand-ups like right before their shift. And if providers can drill down to a 3 to 5 minute presentation, or even little cards that they can keep in their pockets, they're looking for something concrete. They're people who want to help other people. So they want to know what they can do. So we as providers need to meet them where they are.
That's right.
I'm sorry,
and I think 3 to 5 minutes or an app on their phones, something like that, that they can constantly refer to would be brilliant.
Absolutely. And I think to your point, having the numbers for adult protective services, the local ombudsman programs and licensing can really give them a quick, oh, this is who I contact to say I have a concern. Someone asked, is there anything similar to Eagle that is geared towards first responders?
No, we need to do it, don't we?
Oh,
I think that's absolutely right. So we've got to come up with a good acronym for them, maybe another name for another bird, but using EMTs as part of the word. No, I'm not aware of anything. I did my own trainings with paramedics, but we do need to. And so what I'm going to do is I'm going to take that comment and I'm going to present it to the National Center on Elder Abuse and to the Department of Justice in Washington, D.C. and say, okay, I think now we need to develop Eagle and embrace first responders.
I would just add that question comes from Donata, who works at Senior Advocacy Services in Sonoma County, and they have done a lot of work around emergency preparedness. And I would love her to be included in that process because she's done some really important collaborative work. And I would love to see some on the ground. We can get behind that, Paul, and certainly would employ that training.
Right.
We had some questions around multidisciplinary teams and sort of who should be at the table. And I'm wondering if you have a thought on how we can be working with forensic accountants, because Lord knows I, as a nonprofit person, I took exactly one math class in my bachelor's, and I'm not qualified to do anything other than manage my own bank account. And so how can we as service providers identify appropriate people to come to the table, like forensic accountants, fiduciaries, experts in real estate? Because often we only know our slice of the pie and we're looking for trusted partners, but we're careful about that. So how can we find those partners?
Well, sometimes you can find them within actual government agencies. I know the California Attorney General's office has their own forensic accountant. But then I also looked outside to retirees. And sometimes that's where the benefit of going to somewhere like a Rotary Club can really help. Just by throwing out in a 20-minute presentation, by the way, I'd really like to know, do you know any good forensic accountant people or people who just retired from being a CPA? I'd love to chat to them. And that's how I would get to hear about people. But again, forensic accounting, you can do with some very complex investigations, but this is what I would say to my detectives who would investigate elder financial abuse. I say, don't worry about finding all the money. As long as you can bring to me a case that I can prove beyond a reasonable doubt that there's been a theft of over $950, which makes it a felony. And I would say, let's go up to about $1,500. If you can find me $1,500 of theft, bring it to me at that point. Don't wait to try to follow all the money, because then I could ethically issue the case and then we could send out subpoenas. And then I could get the forensic accountant involved as we proceed with the criminal prosecution.
We have a great comment here saying sometimes there's this idea that calling ombudsman or adult protective services gets someone in trouble. And I think we really need to highlight that your duty as a mandated reporter isn't about, doing the investigation, or you're not saying for sure I believe this person's a criminal. You're just saying, my spidey sense is up. I have a concern and I need to let someone else know about this. And so really letting know that folks are not out to get people in trouble. They're out to end abuse.
Well, that's right. I mean, silence is not golden, and silence can often lead to devastating effects. Tragically, I've prosecuted too many homicide cases of older adults where somebody stayed silent 3 or 4 years earlier.
Mm.
And had they not been silent, maybe that person would still be alive today. On the other hand, I have talked to a lot of particularly older parents who called 911, but they didn't necessarily want their son or daughter to be, quote, arrested or jailed. They just wanted, quote, help for them. And so I think sometimes there needs to be this balance by us to figure out, once we identify that this person is a victim, what is the right appropriate solution to deal with the suspect? Sometimes the suspect requires mental health treatment rather than jail.
Mm-hmm.
And so we need to be open to alternatives to direct custody, but at least give us time to separate victim from suspect so that other people can come in and offer a new plan.
Yeah, good point. Well, Paul, we have so many more questions that I know we don't have time to get to today. So I say to everyone, Paul has been our guiding light this year. We will absolutely have him back in the coming year. So always hold those questions and be sure to capture his contact information. I would leave you with one of the comments said, what do we do to train schools? That I think you pointed out well, that we need to be resourced in the same way that child abuse is resourced. We need to have systems in place where our reports can't fall through the cracks. And perhaps that could be our guiding thrust for this next year is how can we raise up this issue so that we are funded at the level that the abuse is happening and it is well as information rich as you would see around child abuse. So with that, Paul, I want to thank you for all of your work over the course of this last year and engaging with our community. We will no doubt see you again. I want to remind everyone that we are going to be on summer vacation in July, so you will not see us here, but we will be back in August. And I hope all of you take some time to care for yourselves and prepare to come back strong for this next cycle as we as California are recovering. I also want to take a moment to invite you to our upcoming party. We here at Ombudsman Services of Contra Costa, Solano, and Alameda, which doesn't exactly roll off the tongue, are changing our name to more fully reflect our scope of services. So on June 24th at 4:30 p.m., we're going to be doing an exciting virtual unveiling. We're going to be dropping the link in the chat where you can register. We would welcome all of you, our elder justice warriors, to come with us and celebrate virtually. Now it is bring your own cocktail, so you'll have to do that on your own, but I would love to see you there. With that, I want to thank everyone for coming this month. Thanks to our ASL interpreters and closed captioning folks. We look forward to seeing everyone back in August.